Now, in the wake of rising COVID-19 cases, Health CS Kagwe is currently addressing the media at Afya House right here in the capital, Nairobi. Let's first of all listen in.
With majority being managed under home-based care and isolation. We, however, know that the steady increase in new infections is likely to get worse in view of the drop in temperatures occasioned by the current season. And I think it is important for us to appreciate that we are faced by a number of challenges that are going to affect these numbers. The first one is that we are in a political season where everybody is out there in the open, many gatherings continuously at all times. The second situation is, of course, the weather and the temperatures that we are experiencing during this influenza period. The third one that we are experiencing as a challenge is also the slow uptick of vaccination rates that we have, up from over 300,000 per day down to about 12,000 per day, and now likely dropping to about 5,000 per day. So we expect a rise in the number of cases of respiratory diseases during this period. Indeed, 3 out of the 8 influenza surveillance sites, namely Kakuma, Kenyatta National Hospital, and Nakuru, are reporting an increase in the number of flu cases. We expect to have a lot of more colds and flus with similar presentations like COVID-19. Therefore, there is need for all those with respiratory-like illnesses to seek appropriate medical care and be tested for COVID-19 to inform proper management. The ministry advises the public to take measures that I'm going to ask the Director General to speak to when I give him the opportunity to do so. Ladies and gentlemen, with regard to vaccinations against COVID-19, the ministry has managed to vaccinate as follows. Vaccination status above 18 years old is as follows. Some 8,578,000 are fully vaccinated. Some 2.4 million are partially vaccinated. Some 404,000 have had booster doses administered. 31.5% is the proportion of adults fully vaccinated. Vaccinations of persons between 15 and 18 years old is 1.5 million doses administered, 820,000 partially vaccinated, and 340,000 fully vaccinated. Regrettably, as I mentioned earlier, the vaccination rate has dropped. And this is an area of concern because the statistics we are holding at the moment, with about 77 persons currently hospitalized in hospitals, but the evidence we have is that most of the ones in hospitals are persons who have not been vaccinated. A lot of the positive cases we have of persons who have been vaccinated are essentially presenting mild symptoms. So the solution, ladies and gentlemen, is number one, we need to revise our vaccination rates. Kenyans are advised to get vaccinated. Those who have not been vaccinated should do so immediately. Those who have been vaccinated and need a booster shot should take the booster shots immediately. And we appreciate that mask wearing is also part of the measures that we are supposed to be. And we explained earlier that the measures that we took at the time that we did them was as a result of the fact that we had gone down. But with regard to wearing of face masks, the mandatory wearing of face masks in open public spaces, where one is not in close proximity with another person, remains optional. However, one is required to wear a mask when in contact with other people in close confined spaces such as PSVs, aircrafts, offices, supermarkets, marketplaces, and places of worship. All persons, indoor meetings to continue at full capacity of the venue, but provided that people take measures to be fully vaccinated in order to do so. And all attendees are required when indoors to be wearing masks. We have seen situations, for example, in political indoor meetings, where we are getting super spreading at a very fast rate, as you have seen for yourselves. So citizens are urged, Kenyans are urged to ensure that they wear masks and are fully vaccinated who are to attend those meetings that are town hall meetings. We are not restricting the in-person worship, and we shall continue to do so in full capacity. Again, as long as all the congregants and worshippers are also fully vaccinated. We also require worshippers to wear their face masks while inside the places of worship. All international travelers arriving into the country and who are fully vaccinated are exempt from the requirements of a PCR test and are exempt from quarantine upon arrival in the country. All unvaccinated travelers arriving at any port of entry into Kenya for whatever reason are required to be in possession of a negative PCR test results conducted not more than 72 hours before departure, regardless of the route of entry. You appreciate that the reason why that particular clause exists is because sometimes, especially in the walk-in boundaries, it is possible that a person can walk in without being fully vaccinated. Otherwise, on flights from overseas and elsewhere, it's very clear that no traveler is to come into the country until they are fully vaccinated and fully boosted. Unvaccinated travelers arriving at any point of entry will be subjected to a rapid antigen test at their own cost. Any person who tests positive to an antigen test is subjected to entry to a PCR test at their own further cost and are self-isolate again, according to our guidelines, at their own further costs. All passenger services, as in vehicles, trains, and domestic air services, will continue operations at full conveyancing capacity. I'm urging county health departments to scale up their surveillance efforts and to be on the lookout for any increase in cases presenting with like-flu symptoms and ensure they get tested for COVID-19. The ministry has adequate rapid antigen test kits for distribution to all counties. Counties are also urged to revamp their isolation facilities and secure adequate supplies of PPEs and particularly prepare with oxygen supplies as part of preparedness to manage any surge of cases. I also make an appeal to the political class in this campaign period to urge their supporters to get vaccinated against COVID-19 and to wear masks during political rallies. Kenyans are also urged to exercise personal responsibility while attending the rallies. Remember, rallies might be important, politics is important, but there is nothing that is more important than your life. Ladies and gentlemen, I would like to thank the media for continuously sensitizing Kenyans on the COVID-19 containment measures. As I conclude, I would like to make a passionate appeal to all Kenyans. Please join us in this campaign to ensure that many people are vaccinated. We would like to vaccinate all adult population by the end of this year, which is a target that we have already missed because of the slow uptick. We were supposed to have finished it by June of this year. This is the only way to protect ourselves, our families, and the community at large, because the vaccines are safe, effective, and available. I thank you. I would like, before you ask questions, I would like to give this opportunity to Dr. Amoth to address the issue of what to do if for you to prevent yourself from getting vaccinated, from getting sick.
Thank you, Honorable CS. Kenya has 2 flu seasons. The first season starts usually from March and lasts until May. Then the second flu season starts from around July and lasts till October, November. But you've seen the cold season has come earlier this time than is usually the case. And the best way to ensure that we are protected from getting flu, common cold, or any other respiratory tract infection, one is that if you have flu-like symptoms, please stay at home. Don't go to work and expose other people, because flu, common cold, COVID, like other respiratory tract infections, are highly transmissible. Number 2, you need to keep warm, dress warmly. I can see most of you are dressed warmly to avoid triggering flu-like situation. Avoid crowded places and gatherings. Keep hydrated. Take plenty of fluids, water, tea, uji, or whichever beverage of choice you choose. You exercise regularly, because regular exercise leads to release of various substances that act against inflammation. You need to maintain hand and body hygiene. Wash hands frequently with running water and soap, or use sanitizers. Also, eat a healthy, balanced diet, especially one rich in fruits and vegetables, especially the green leafy vegetables, because they contain antioxidants which enhance our immunity. And of course, despite doing all this, if you happen to get a respiratory tract infection, the next course of action, of course, is to seek medical advice from a qualified medical service provider or facility, and then you'll be able to get the correct treatment and advice. In a nutshell, those are the measures that we can take at individual level. And I know Kenyans love ginger and honey and lemon during this season. Please go ahead. Those are rich in antioxidants and will help protect and increase your immunity, such that even if you get a common cold or flu or COVID, then it's likely to be milder. But above all, of course, to be able to protect you further is to go for vaccination, because the vaccines are available, they are safe, they are robustly tested, and they will protect you from getting severe COVID-19 situation. For those who are immunocompromised, those who are elderly, those who have coexisting medical conditions, on top, of course, of the COVID-19 vaccine, there's also the flu or influenza vaccine that you can be able to take. So far, the influenza vaccine is not part of the routine immunization services, but we are working with other partners to ensure that it will be part of the routine immunization antigens delivered to our people, especially those who are at risk. Thank you.
Santeni, thank you very much, Dr. Amoth.
That's a live feed from Afya House here in the county of Nairobi, the HQ of the Ministry of Health there. Mutai Kagwe, CS for Health, they are flanked by the DG for Public Health, that is Patrick Amoth there. In a nutshell, is that new cases have been reported and there's a steady increase there, occasioned by the weather and also by the low uptake of the COVID-19 vaccinations. And there they're taking us through some of the things that you're supposed to do, including if you have flu-like symptoms, you stay at home, you keep warm, take lots of fluids, eat a healthy budget, and also exercise.